Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to use the whiteboard to discuss how a heart attack happens. So James Gandolfini, Tony Soprano just died apparently of an acute heart attack, and it asks the question, how could someone be 51 and healthy one day and die of a heart attack the next day? So what happens with a heart attack is your heart is a big bag, basically, hollow muscle. There's the four chambers in the heart. The top of the heart, the aorta, comes out, and that feeds the blood to the rest of the body. Right at the base of the aorta, the most oxygenated blood that we have is blood vessels that come off, and they actually feed the heart muscle. So the heart gets the first and best blood supply going to the body, and these are called the coronary arteries. All right. What happens in a heart attack is not that there's a blockage per se of the blood vessel. So here's your blood vessel. It's just a big tube, and we would think about heart disease as blockages and narrowing of the blood vessels, and over time, like a sewer pipe, the blood vessel starts to become plugged, and that causes a heart attack. And that's not actually what happens. What happens is that we have cholesterol deposits in the arteries, and if you think of it as a egg yolk sitting in the inside of a blood vessel, so you've got this blob of cholesterol inside of a blood vessel, and we might describe that as a 60% blockage. So there's 40% opening, plenty of room for the blood to get through to go to the heart or the rest of the body, and that's not what happens with a heart attack. What happens is that we have a rupture of this plaque. So what we think happens, or we know happens, is that this egg yolk bursts open and spills the contents out into the artery, and that happens abruptly. So your egg yolk's sitting stable 1 second, and the next second it ruptures and you have the contents come out. You have platelets, which are little potato chips floating through the bloodstream, and these are what plug a tear. So if you have a cut in your knee, the lining of your blood vessels or the endothelium are exposed and you start to bleed, the platelets will actually come and stick to the lining of the blood vessels or the endothelium, and that causes the blood to stop bleeding or creates a scab. So inside your blood vessel, this plaque ruptures, platelets that are floating by stick to the lining or the endothelium, and they have what's called platelet aggregation factor, and all of a sudden you have platelets that are trying to plug what they think is a cut in the knee, and it causes, in a matter of even just a few minutes, 100% blockage. So you go from a stable 60% occlusion. You could have had a stress test the day before, passed it with flying colors. You could have had an angiogram and passed it, and then the next day this plaque ruptures, and all of a sudden platelets start to stick, and you get this acute heart attack because it blocks all of the blood. When we take an aspirin as a preventative for heart attacks, aspirin decreases the stickiness of platelets. So if you have this rupture, the platelets go by, they're not quite as sticky, they don't cause that abrupt blockage of the blood vessel. When we have an angioplasty, what happens is we have a blockage like that, and we say that's a 50 or 60% blockage. We'll put a little tube in the blood vessel, and attached to this tube is a balloon on the end of the tube. So the balloon is put into the blood vessel, and then it's inflated gradually, and what that inflation of the blood vessel does is it smashes the plaque down. They take out the angioplasty balloon, and then we're left with a plaque that's smashed down to maybe 10 or 20%. They oftentimes go back in and put a stent in. So after they smash the plaque down, they put a little straw in made out of metal, and this straw sits in there, and that prevents that plaque from building up again. So the stent, the blood goes through the stent and keeps it open, and then you take a blood thinner so it doesn't stick to the lining of the stent. So unfortunately, when we have a heart attack, it is not like the plumbing in your house pipes, where over time you notice that the plumbing gets slower and slower as we get the deposits building up. So we go from a 20 to 30 to 50 to 70 to 90 to 100% blockage. If we did that, would be great, because you would have very gradual onset of symptoms and you would go to the doctor. So if you think about it, you have your plumber comes out, he checks all your pipes, he says your pipes are clean, and you've got a clean bill of health. The next day your kid comes and he flushes a sock down the toilet and you got water all over the bathroom floor. That's what a heart attack is. It's oftentimes unpredictable. We have a very short amount of time after the onset of the heart attack symptoms to get to the hospital to open that thing up, either using medicines to dissolve the plaque or going in and getting getting an angioplasty and a stent placed, or getting actual bypass surgery where they take out that whole piece of blood vessel and put a clean piece in its place. We have what is called sudden cardiac death, and that's either because you have such a massive blockage, the heart muscle has no blood flow and it dies almost instantly, or what more oftentimes happens is you have a decrease of blood flow, the heart muscle becomes irritated and then has an arrhythmia. So instead of beating in a normal contraction, it beats in an abnormal contraction, something called ventricular fibrillation, and the heart literally is just spasming, and it literally can happen in a matter of seconds. Your blood supply shuts off instantly, and you've got about a minute or two before you succumb to brain death and what's called sudden cardiac death. So James Gandolfini, we'll see what happened to him. It may or may not have been a heart attack. It sounds like it was. They'll do an autopsy. They'll look at his heart and see if he had evidence of scarring in the blood vessel that blocked. Unfortunately, a very common cause, also very scary, is most heart attacks happen without warning. So the majority of people who have their first heart attack had no chest pain or heart symptoms leading up to it. As many as 50% of new heart attacks actually will end in death. This has gone down quite a bit and probably is less than 50% now with early intervention, with people taking their baby aspirins at home when they have chest pain even before the paramedics get there, with angioplasty labs at the hospital, so the paramedics will call with somebody with chest pain and EKG changes, and they are actually already calling the heart team in before the patient even gets into the hospital. They're setting up the angioplasty lab. So go to your doctor, get your routine care. Even with a normal stress test or even with a normal angiogram, you still can have a heart attack the next day. Treat your blood pressure, treat your cholesterol, talk to your doctor about taking baby aspirin as a preventative. Dr. Greg Castello, thanks.